Bunions and hammertoes are hereditary issues that people deal with, and it causes pain when you try to wear a shoe. Typically don't cause pain as long as you're barefoot or in flip-flops. Your feet have enough room to spread out, but they're hereditary. You got them from mom, dad, someone in the family. That's how you get them. But very treatable. Most of them require surgery because it's a bony deformity of your foot. And so there's many different surgeries to correct them. They're very successful surgeries, but you do have to go through that procedure to get it fixed. Challenges of treating bunions and hammertoes stem from the shoe gear. They start with patients who want to wear tight shoes or small shoes, dress shoes. That's most of your challenge when dealing with them initially. After that, depending on the size of the deformity or how bad it is the degree of surgery that you need in order to correct it. Because again, it's a bony deformity, and there's really, they sell a lot of different things on the internet. I'm sure you've seen where they have straps that pull it over and hold toes down and that type of thing. And those are good as long as they're on, but as soon as you take them off, the toe goes right back to where it was. And so those are good for our non-surgical patients, the patients who are not candidates. But for the most part, you need to do some procedures to get things fixed. Our goal in treating a patient with a bunion or a hammer toe or any bony deformity is first to try and allow that deformity to exist and not do surgery. However, if it's to the point where they're going to need that intervention, that the point of our treatment is to come up with a goal with that patient and a time, and basically just formulate our treatment and the procedures to the patient's wishes and make sure that they're happy with their outcomes afterwards. Because they go through the procedure and they want a good outcome afterwards, and we try to make sure that they know exactly what they're getting into beforehand. And it's a planned procedure. You plan it to your life, and the procedure's done the same way every time. It's what you do with it when you go home that gives you the outcome that you get. Bunion and hammertoe surgery is the bread and butter of our practice. We treat a lot of bunions and hammertoes. We're doing surgery on them every week. And have done for years. We're very good at it. The vast majority of our patients are very happy with their success rates on their surgery. They do extremely well in our care. We talk them through every aspect of the procedure beforehand. They understand exactly what's going on with their foot before they get into it. Visit our blog for tips on how to treat this at home. However, there's less treatments for bunions and hammertoes, but wearing wider shoe gear and that sort of thing can help. Call if you'd like a consultation. We call it surgery discussion. We sit down, we go over your x-rays and tell you exactly what we would want to do. Once you have that information, the ball's in your court. You call us if you need us, but you'll understand exactly what we need to do beforehand.